Greetings, house scholars, and welcome or welcome back to another powerhouse conversation on the House Scholars channel. If this is your first time tuning in, welcome. My name is Dr. Robisa, and I am so happy to have you here. On this channel, I show current and aspiring healthcare professionals how to one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. And so, if this sounds like a plan that you can align with, then I highly encourage you to subscribe to the channel, turn on your post notifications, turn on your notification button, like this video. I promise you will leave the community better than what you came when it comes to the business of healthcare. Now, tonight I am very live. So, if you are watching live, please let me know where you're tuning in from. Let me know if you have any questions. You can drop it in the comment section, whether you're on YouTube or if you're on LinkedIn. I'm very live tonight. Had a busy week, so I didn't get a chance to pre record, but it's always great to connect with the community. And so tonight, also, we're going to talk about the role of a health quality improvement specialist. And I know that this is a position that is pretty popular in the healthcare administration management sectors, but I want to give you some deep insights on really how to navigate this profession if you're interested in this role. But I'm going to give people a few moments to come on because, like I said, I'm very live. And so let me know where you are tuning in from. All right, we have, let's see. Greetings from Maryland, the journey with D. Thank you, D, for joining. It's a pleasure to have you here. Thank you for tuning in. Like I said, I am very live, so let me know where you're coming in or watching from. That would be great. All right. And while people are coming in, I'm gonna just forge ahead. And so, like I said, tonight I want to talk about a healthcare quality improvement specialist and really what this profession is all about. And so, without further ado, let's jump into the conversation. So, first things first, what you must know about this role is that as a health QI specialist, quality improvement short, right, that you really help healthcare organizations meet and adhere to the regulatory requirements. This is key. All right. And in being a QI specialist in the healthcare sector, you also help improve quality for patients. So, patient outcomes is a very big thing in the healthcare space. And that is one of the reasons why the healthcare system is even in fruition. We are in the business of serving patients at their greatest point of need. And so, we need individuals who are trained to help us assess the quality of care that we provide to them, help us understand some of the gaps that happens when we are delivering patient care services and they may not be reaching our target audience effectively. All right. And so I see more people are coming in. Okay. All right. We have a LinkedIn user. Hi from Canada. Hi. It didn't show me your name, so I'm sorry. But thank you for tuning in. I'm very much live. So if you have any questions, please feel free to drop it in the comment section. I'll do a Q&A portion after my teaching. Dee says, I'm working on my bachelor's in health services management. Awesome. So this may be a perfect role for you. And so, with healthcare quality improvement specialists, you know that you have to focus on implementing systematic systems and processes in order to identify areas for improvement. And this can be on the organizational side, or it can really be specific to patient care. It can also be specific to safety and just overall healthcare outcomes. Now, these are some focus areas of a QI specialist, and I always like to just really explore the role in great detail. And so let's just talk about their job description. So, the first things first, one of the major requirements of a healthcare QI specialist is being a data analyst. And so you collect and analyze healthcare data to really identify several things: trends, areas for improvement, patterns that are happening in the organization, and whether these patterns are being beneficial to the organization or that they are causing some type of decline. Also, outside of just your internal organization, you're looking at the trends of the healthcare system wherever you are based. And so I know we have a few people on from Canada. And so in the Canadian healthcare system, if you were working in this role, you're looking at healthcare trends across Canada. For us in the US, we're looking at healthcare trends across the US and how does it compare or contrast to the organization that we're working in. Another key component of a QI specialist role is quality assurance, hence in the name. Quality improvement. And so when we think about quality assurance, you're really implementing and monitoring quality assurance type programs to really ensure that the healthcare services that are being rendered is meeting the standards. And there are so many different entities that you may have to be assessed by, and from regulatory to risk to legal to the insurance companies for us here in the US. And so, really, quality is a big role. Then looking at processes. This is also another major component of this role. Looking at the current way that we're doing things in the healthcare system or in this organization as it relates to delivery of care. Is it effective? And if it's not effective, how do we improve it? How do we change it? And there's so many different models and techniques and theories around really improving how we deliver care to patients, because we know that quality care really is one of the key goals of the overall healthcare system. In addition to quality care, you want to make sure that you're rendering care that's timely. You want to render care that's safe. You want to render care that is effective. Now, when it comes to the educational requirements of a healthcare QI specialist, at minimum, you should have a bachelor's degree. And that bachelor's degree can be in healthcare administration, it can be in health information management, or a similar discipline. So, some similar disciplines can be also like public health. If you're really focused on the policy administration side, also you can do nursing. This is another degree program that can also benefit from working in the role of a QI specialist. But many organizations, even though the economy is changing, still prefer for healthcare QI specialists to have a master's degree, and a master's degree in some type of quality driven program. So, like having a healthcare quality improvement master's degree, or health administration is another good one, healthcare management, public health, business administration as well. Now, if you are not a person who does not have the formalized education that is required of a healthcare QI specialist, another route that you can go to through in order to acquire this role is certifications. I advocate a lot for certifications because it's the easiest way to acquire information that you need in order to get hired in the role. All right. So, some certifications that are common or popular in a healthcare QI role include being the certified professional in healthcare quality. You also have joint commissions. All right. So, I don't know if this certification is offered outside of the US, but certified joint commission professional is definitely here in the US. Joint commissions is a regulatory entity that accredits and certifies healthcare organizations. And so, if you are certified in their processes, it can really help a healthcare organization go really far. Additional certs, this is another common one, Six Sigma certification. So, like having the green belt, the black belt. While Six Sigma is not only dedicated to the healthcare space, you can get a Six Sigma certification and work in roles like healthcare quality improvement or performance improvement or even business management. They can use the Six Sigma certifications, that education they acquire, and it will go a long way. Another certification that's really instrumental to a healthcare QI specialist role includes being a certified professional in patient safety. And let me tell you this, safety in the healthcare space is very instrumental. I cannot stress this enough. The worst thing that you don't want as a patient is to come into a healthcare entity and that they take your livelihood, you're living at risk. They don't do things that will ensure that you can come out of their entity safely with healthy. And so, even in the inpatient side, they're looking at admissions and discharges. And so I know with CMS, which is the Center for Medicare and Medicaid Services here in the US, they actually fine healthcare organizations like hospitals should they discharge a patient and the patient returns or be readmitted within less than 30 days from their first time they were discharged from the hospital. So Patient safety is a big one. And if you were interested in this role, you should be somebody who is really much invested in helping healthcare organizations keep their patients safe. Now, I always like to give you the full picture, and I always like to share alternative job titles that can help you find a role or work in a position as a healthcare QI specialist. And so some other ways that they identify this particular position can include being a quality improvement coordinator, quality improvement analyst, performance improvement, and like performance improvement and quality improvement are not the same thing. I just want to stress that. They are not the same thing. However, they do work hand in hand, right? Looking at quality, looking at performance. And you really want to make sure that in all areas of your healthcare entity that they're performing well and that the care and the product of this performance is of quality. So they're not the same, but they go hand in hand. So keep that in mind. And then also clinical quality analyst, you have healthcare quality manager, continuous improvement specialist. So this is another role that is very common. And so, like I said, depending on which organization that you work for, they may label a healthcare quality specialist role similar to the titles that I have on the screen. Now, I always like to talk about the money. And when we think about just the payment or the salaries of a healthcare QI specialist, on average across the US, they get paid anywhere from like $80,000 to $90,000 per year. Oftentimes, the type of salary contract is usually salaried, not hourly. So that's amazing. And if you were just getting started in the field, you probably would make anywhere between $50,000 and $70,000. But like I said, it depends. It depends on so many factors. How well you negotiate, the organization's budget, your educational background, your experience. This is a role that also prefers their candidates to have some experience in the healthcare space. And so just keep those things in mind. Right. So just use these salary ranges as just ranges. But depending on how well you negotiate, you can probably fall into this range of the 50 to 70,000 when you're starting out. If you've been there for a while, about $70,000 to $90,000 per year. And on the upper income tier, it's about $100,000 or higher. So it has the potential to be a six-figure earning position, right? But then, like I said, it depends on a lot of things. Now, one of the things that I also wanted to share with you, should you be a person, like we have some people here who are not in the US, they're not based there, but this is a role that also is done in other countries. And so, should you be interested in quality improvement and you want to work as a healthcare quality improvement specialist, there are opportunities for you to do this outside of the US. And so, when I think about some of the countries you can work in, there are a few in Europe, Australia, Canada, and even India, which I was quite surprised that India has a big market for healthcare quality improvement specialists. And so when I looked at the salary breakdown, so if you're working within the European country, the average salary is usually about 30,000 euros to 60,000 euros per year. If you were based in Australia, it's about 70,000 Australian dollars to $120,000 Australian dollars. Canada, the starting range is about 60,000 Canadian dollars to 100 plus thousand Canadian dollars. So that's key. And then the Indian rupee, which is like 4 million to 9 million is the range. So I did not know when I was doing my research for this position tonight that there was a big healthcare quality improvement market in India, but it could be an option for you. And then, what are the types of organizations that hire healthcare QI specialists? So, I would tell you, of course, hospital systems and healthcare systems, health insurance companies, as well as clinics and ambulatory care centers. So, your outpatient facilities also are very instrumental in hiring QI specialists. Governmental facilities, managed care organizations. Now, I don't know if countries outside of the US have a managed care sector of their healthcare industry. But here in the US, we do have managed care, and they're often looking for QI specialists, quality improvement organizations. So there are consulting firms that is what they focus on. They are send their consultants out to partner or to work with healthcare entities to help them improve the quality of the services that they're delivering offering, especially as it relates to patient care. All right. So the $1 million question is becoming a healthcare QI specialist right for you? And I would tell you this role is right for you if you are an individual who will enjoy helping healthcare organizations improve their patient care outcomes, and specifically not just improving their patient care outcomes, but also aligning and adhering to the quality and regulatory guidelines that are out there. And like I said, regulatory compliance is a big thing with this role. And so if you're not a person who's interested in learning the law, reading the law, looking at all different types of policies, this may not be a role for you. All right. So that is all that I have on that position. But I know for many people are joining now. So I'm very much live tonight. I did not want to not meet my expectation or my commitment to you all. So I came on live tonight. So if you have questions, please feel free to drop it in the comment section. I am more than happy to take a few questions before I head out for the day. But I hope this role was helpful for you tonight. For those of you who are just joining in, we talked about the role of a healthcare QI specialist. And so QI stands for quality improvement. All right, so let me go to the queue and see, does anyone have any questions? All right, let's see. Okay, the LinkedIn user is Shannon. Hi, Shannon. Thank you for joining. It didn't show your name, but thank you for joining. All right. And D says, currently I'm a patient care technician, so this is perfect for you. Absolutely. It is indeed a perfect role. I used to train PCAs or PCTs per se, and you guys also have the best of both worlds. You get an opportunity to see the clinical side, but you also get to explore the administrative side through the quality of work that you do. So depending on if whether you're in the hospital or on the outpatient side, you really get to see best of both worlds and deliver care. And you see the areas where quality needs to be improved, where patient care services may need to be improved, what our organizations do to make sure that the care that they're providing is delivered effectively. So I encourage you, D, to go out and apply to the role if you feel like the time is now. Just make sure you have all of your credentials in a row, and I'm wishing you all the best in it. Okay, let's see. Anybody else have any questions? All right. All right, I'll stay on for maybe like 3 minutes. I didn't want tonight's live to be long. Once again, thank you all for joining. I am very much live. So if you're watching in from LinkedIn or if you're watching in from YouTube, welcome. And it's a pleasure to have you here. Please feel free to drop your questions in the queue, or I think it's the comment box when I'm live. But should you have questions after this live, you can always drop it in the comment section. And once I respond to comments, I will provide you an answer there. Okay. Well, I don't see anything else. So I'm going to take this as an opportunity to head out. But once again, thank you all for joining tonight's session. I do have other videos coming up this week. So tomorrow we're going to talk about, I believe it is a healthcare project manager. That's the video for tomorrow. So we got a good lineup this week. So until then, have a great rest of your evening. Make sure to like, share. Okay, hold on. There's another question come in. All right, you caught me on time. You said a master's in health information management would be okay. Yeah, I've seen many physicians who are health QI specialists. They've accepted that as health information management because remember, there's a data analyst component to the role where you are collecting and interpreting data a lot, and how to manage that data from a digital side is important as well. And so it is indeed a road for you. All right. Like I said, I don't see anything else here. So once again, thank you for joining. Have a amazing rest of your evening. And until tomorrow for Careermas Day 7, good night.